everyone. First of all, I'd like to thank the organizers for this opportunity to share relevant information on COVID vaccination in children 12 to 17 years of age. As an outline of my presentation, I will give a brief introduction followed by the discussion on COVID-19 in children, COVID vaccines used for children ages 12 to 17, the benefits versus the risk in receiving the COVID vaccines, and the summary. COVID vaccines are less effective at preventing infection and mild symptoms, but they are highly effective at preventing severe illness and death caused by COVID-19 variants, including Delta variant. Children account for 12% of COVID-19 cases and 1.6% of deaths in children less than 5 years of age in the Philippines. COVID-19 in children is primarily a respiratory disease manifesting as flu-like illness with fever and cough as the most common symptoms. Most cases are mild, but some may have severe and critical manifestations, including multisystem inflammatory syndrome in children or MIS-C. Once you get infected with the virus, you can be asymptomatic and therefore can just stay at home with supportive treatment. On the other hand, you can have symptoms which can be mild to moderate, or you can have severe or critical COVID which will need hospitalization. Having symptoms can potentially lead to long COVID-19, where you can manifest with signs and symptoms referable to the heart, the lungs, and the central nervous system. Or you can die from COVID. COVID-19 in children is not so ordinary. After 4 weeks or more from COVID infection, they can have new or persisting symptoms from acute infection or exacerbation of a chronic condition. It can also range from asymptomatic to severe. There has been evidence of new or persisting symptoms in adolescents or the young in up to one half of those study participants who developed symptoms 1 month post-diagnosis. The symptoms include fatigue, insomnia, rhinorrhea, muscle pain, headache, lack of concentration, exercise intolerance, dyspnea, and chest pain. Multisystem inflammatory syndrome in children, or MIS-C, is a severe hyperinflammatory syndrome occurring 2 to 6 weeks after acute SARS-CoV-2 infection among persons less than 21 years of age, resulting in a wide range of manifestations and complications. 60% or more of patients are admitted to the intensive care, and about 1 to 2% die from MIS-C. Myocarditis is the inflammation of the part of the heart muscle, and patients with COVID-19 infection are 16 times at higher risk of having myocarditis. It can also occur in patients without COVID. And the best way to protect against COVID-19 related complication is through vaccination. Children with comorbidities are twice more likely to have severe COVID and or require intensive care, and 3 times more likely to die from COVID. Obesity has been reported as the most common pre-existing condition. Obese children are 3 times more likely to have severe COVID. From the Salvacion study, children and adolescents with coexisting illness or medical comorbidities are believed to be at higher risk for severe COVID-19 disease. For hospitalized children from select Philippine referral institutions, comorbidities reported were neurologic or developmental, renal, hema-onco patients, cardio, gastro, and immunodeficient ones. The Philippines is raising its target COVID-19 vaccination coverage to include 90% of the country's population after the highly transmissible Delta variant ramped up herd immunity thresholds for the disease. If you look at our Philippine population demographics, those 18 and above make up 62% of the population. If you include 15 years old and above, it goes a little higher by 68%. And those 18 years make up less than 18 years of age make up 38%. So we can achieve the 90% by vaccinating children. These are the countries which are already vaccinating their children from different age groups against COVID 19: US, Canada, UK, Scotland, European countries like France, Netherlands, Germany, and Italy, and Australia have already started vaccinating 12 years and above. Just recently, the US started vaccinating 5 to 11 years of age. In France, majority are fully vaccinated. Denmark and Spain both have vaccinated most of their child population with at least a single dose. China aimed to vaccinate all 12 to 17 by October. Argentina started giving Sinopharm in 3 to 11 years old and acquired 3 million doses of Pfizer in October to advance in the inoculation of adolescents without comorbidities. Chile gave Sinovac to their 6 to 11 years old and Pfizer to 12 years old. China set a rough target of vaccinating 80% of its 1.4 billion population by the end of the year, a figure impossible without jabbing less than 18 years of age. In India, they have started giving Bharat for 2 to 18 years old. And in Australia, they have given Pfizer for 12 years and above and is now eligible to apply for provisional approval for the vaccine to include 5 to 11 years of age. The COVID vaccines with approved EUA for 12 to 17 years in the pediatric population in the Philippines are the mRNA-based Moderna and Pfizer. Research has shown that the Pfizer vaccine is 100% effective in preventing the COVID 19 virus in children ages 12 through 15. Moderna reported that its COVID 19 vaccine is 100% effective in 12 to 17 years old with immune response similar to that seen in vaccinees 18 to 25 years old. For Pfizer, the overall efficacy is 95% for 16 years and above against symptomatic laboratory confirmed COVID 19, 100% vaccine efficacy against COVID 19 associated hospitalization, and overall efficacy of 100% against symptomatic laboratory confirmed COVID 19 in adolescents 12 to 15 years. The immunogenicity of Pfizer is non-inferior to 16 to 25 years of age. For Moderna, the overall efficacy is 94.1% for 18 years and above against symptomatic laboratory confirmed COVID 19 and 89% vaccine efficacy against COVID 19 associated hospitalization. The most common side effects in children are similar to adults. You can have pain, redness, and swelling on the arm where you got the shot, and throughout the rest of your body, tiredness, headache, muscle pain, chills, fever, and nausea. Adolescents are more likely to experience side effects after the second dose of the vaccine. Not everyone's experience will be the same, and some may not even experience side effects. Some of the side effects of the vaccine overlap with the symptoms of COVID. Remember, the vaccine will not cause or give you COVID 19. Fever, chill, headache, body aches, and joint pain are seen in both COVID 19 infection and as a side effect of COVID vaccination. Symptoms such as sore throat, runny nose, shortness of breath, cough, and loss of taste or smell are signs and symptoms of COVID 19 infection, and immediate reactions like urticaria, hives, anaphylaxis, and local symptoms are side effects of COVID vaccination. Direct benefits of COVID 19 vaccination in adolescents are reduction of disease burden by preventing COVID associated hospitalizations and mortality in children, positive safety assessment of the mRNA vaccines, and strong immunogenicity and efficacy against symptomatic COVID 19 in adolescents can reduce disease burden. Vaccination can also prevent post infection syndromes, including MIS-C and long COVID, as long COVID has increasingly been recognized in children. And although the duration of neurocognitive sequelae remains unknown, it could be prevented by altogether routine COVID 19 immunization. COVID vaccination in adolescents will minimize routes of spread to high risk individuals, children with immunodeficiencies, cancer, chronic illnesses, and high risk adults. It will also allow for social reintegration, youth in youth sports, schools, group activities. It also will reduce potential transmission and outbreaks in school, reduce disruption to parents and family work, enhance well-being and mental health, encourage return of regular pediatric care, including vaccination against other vaccine preventable infectious diseases, and less community transmission, reducing risk of emergence of new variants. Vaccinated people are less likely to spread COVID. The risk for SARS-CoV-2 infection in fully vaccinated people cannot be eliminated if there is continued community transmission of the virus. However, fully vaccinated persons are less likely to acquire SARS-CoV-2 infection, and if they are infected with the Delta variant, they have less severe clinical outcomes, less likely to spread the virus even if they become infected. Myocarditis is rarely associated with the mRNA vaccines. They peak in males aged 12 to 17 years. Usually, they occur after the second dose, and most have a mild course with resolution in 95% of cases. No mortality has so far been directly attributed to the vaccine. There's a sevenfold higher risk of acquiring myocarditis after COVID 19 infection compared to vaccination. Anaphylaxis, immune thrombocytopenia, or other significant reactions have not been reported in clinical trials. However, there is a possibility that these adverse reactions may occur. Therefore, careful history taking and risk assessment are a must prior to and after each vaccination. Children play a large role in community transmission of infectious pathogens for daycare workers, teachers, parents, or grandparents. Vaccination of children before school reopening will help control COVID-19 pandemic. Although the risk of COVID 19 is greater among children who are attending school in person, this risk disappears with layered prevention measures. Vaccinating children 12 years and older against COVID 19 can significantly reduce infections and deaths. In the absence of vaccination, the ongoing implementation of non pharmaceutical control measures like wearing fitted masks, observing social distancing, and practicing frequent hand washing are control measures in schools which can also have a positive impact. Vaccine reactions, both local and systemic, are common, mostly mild, and usually occur within 2 days after the first or second dose and resolve after a few days. Systemic reactogenic reactions like fever are more commonly found after the second dose. As with adults, these are managed with supportive care. Prophylactic antipyretics are not advised. Syncope is a reaction to vaccines, almost unique to adolescents and with the female preponderance. Providers must be able to anticipate and provide support in such a scenario during and post vaccination. For every million doses of mRNA vaccine given with current US exposure risks, it would have prevented thousands of COVID 19 associated hospitalizations and only a few cases of myocarditis reported. On September 30, 2021, the IATF approved the commencement of the COVID 19 vaccination in the pediatric population starting with 12 to 17 years of age with comorbidities under Pediatric A3. Note that the vaccination rollout in hospitals region-wide will be implemented once the region reached 50% or more regional vaccination coverage of fully vaccinated priority group A2. Other regions may also conduct initial rollout in selected hospitals. More recently, children 12 to 17 years of age without comorbidities have already been included in the vaccination rollout. Underlying medical comorbidities as risk for severity in children with COVID 19 are as follows: medical complexity, long term dependence on technical support. Example is your tracheostomy associated with developmental delay and or genetic anomalies, genetic conditions like Down syndrome, G6PD, genetic disorders affecting the immune system like primary immunodeficiency syndrome, thalassemia, and other chromosomal abnormalities, neurologic conditions like seizure disorder, autism spectrum disorders, cerebral palsy, stroke in the young, metabolic and endocrine diseases like diabetes mellitus, diabetes insipidus, hypothyroidism, adrenal insufficiency, and hypopituitarism. And for those with cardiovascular diseases, hypertension, congenital heart disease, cardiomyopathy, and rheumatic heart disease. The other underlying medical comorbidities are your obesity, those with BMI of more than 95th percentile for age and height, those with HIV infection, those with tuberculosis, pulmonary, extrapulmonary, and even disseminated TB, those with chronic respiratory diseases, renal disorders, hepatobiliary diseases, and immunocompromised due to disease or treatment. From the DOH, can children ages 12 to 17 years old with comorbidities get vaccinated against COVID 19? Yes. Children ages 12 to 17 with risk factors or comorbidities are now part of the A3 priority groups and will be called pediatric A3. What vaccines can be given to the pediatric population ages 12 to 17 years old with comorbidities? To date, only Moderna and Pfizer vaccines can be given to the pediatric population ages 12 to 17 with comorbidities. These two COVID 19 vaccines have EUA from the Philippine Food and Drug Administration. COVID 19 vaccination of children 12 to 17 years old with comorbidities or your pediatric A3 must be pre registered and scheduled. They must belong to the 12 to 17 years age group. They must have an underlying medical comorbidity as listed in the DOH. They must be accompanied by parent guardian at all times and must present a medical certificate with clearance from their attending doctor. They must provide proof of relationship of parent guardian to the child, example, birth certificate, IDs of both parents or guardian and child, and at the vaccination site, they must give their informed consent and assent, and that health screening will be conducted by the physician at the vaccination site. Lastly, we expect them to be honest. Again, for the dreaded M word, which stands for myocarditis. It is rare, but it tends to be higher in young males 30 years and below. They're more often found after the second dose, usually within several days after vaccination. It is self limited. Management is largely supportive. Most cases are mild. They respond well to medicine and rest, and they feel better quickly. COVID 19 infection poses higher risk than vaccines for myocarditis. For vaccinated adolescents, they should avoid strenuous physical activity for 1 to 2 weeks after any dose of mRNA COVID 19 vaccines. They should seek medical attention promptly if they have chest pain, shortness of breath, fast beating, fluttering, pounding heart, difficulty in breathing, swelling of the face or the throat, has bad rash all over the body, has dizziness, and weakness. Reminder to the parents: to allay fears on vaccination, talk to your child about what to expect. Why do they need a vaccine? What is it for? Who's going to receive and is going to give the vaccine? And how is it going to be given? Observe hand hygiene, social distancing, masking, good ventilation, limit time patient stays in vaccination site, keep them well hydrated, and feed them before going to the site. For hypertensive pediatric patients, ensure that the baby is controlled prior to vaccination. Please do not forget to give their medications before vaccination. Bring the patient's antihypertensive meds. Don't allow them to smoke. Do not allow them to drink coffee, caffeinated beverages, or meds that can increase the blood pressure. For specific recommendations for patients with history of allergies, kidney disease, or immunosuppressants, please consult your doctor. The projected population for children 12 to 17 years old is at 12.7 million plus, of which 1.2 million plus have comorbidities. The rest of the pediatric population is at 11.4 million plus. In the pediatric priority group, pediatric A3, only 40,000 plus or 3% have been vaccinated with one dose. Please don't forget the other vaccines recommended. They also protect against serious diseases. In summary, COVID 19 illness, though generally less severe in minors, has nonetheless caused substantial morbidity and mortality in this age group. COVID 19 is now vaccine preventable. Vaccinating children is critical to protecting them and ending the pandemic. Vaccination provides substantial direct or individual benefits and indirect or public health benefits. Approved vaccines for adolescents are highly efficacious and have favorable benefits versus risks profile. Without vaccination in children, children will continue to serve as a reservoir of SARS-CoV-2 infections. We will continue experiencing preventable morbidity and mortality. We will delay the development of herd immunity. Parents are good advocates. Leverage your social networks. For more information on vaccination, please consult your doctor. And with that, I'd like to say thank you very much for listening and please stay safe.